FaceTite, again, this is the radio frequency plus liposuction version. Not everyone in the room, actually very few in the room are interested in the liposuction. That's why I'm breezing through this. We're going to spend the majority of the time talking about quantum. Again, 12 o'clock, meet me over here. We'll unpack BodyTite in more detail on FaceTite. But FaceTite is the other one that I do in conjunction with liposuction of the jawline. Just look at some results here. Now, of course, let's be honest, this is mostly lipo that got us this result. But as a surgeon, considering this case, there's no way I'm just lipoing this without FaceTite, because before FaceTite, I'd be looking at this thinking, I am going to create the most devolumized, saggy, loose turkey waddler skin you've ever seen in your life. Just a sack of skin hanging down, right? But then with FaceTite, I can tighten up the remainder of that soft tissue envelope. So I can suck out that fat, tighten up the skin. And then so the absence of a huge turkey waddler shows you the power of FaceTite in this. So of course, the result here is majority liposuction on this volume, but the power of the picture is the absence of a huge devolumized sack of skin. You know what I mean? This is a wonderful story. This is why I would quantum or Morpheus this patient now. This was 6 years ago when the only thing out there was like an Optimus and a FaceTite. So now I would treat it a little differently. But before I had my FaceTite, guess what I had as a surgeon? Not liposuction, she didn't have any fat. So for this patient, a scalpel. And I love to use that thing. But I'm looking at her thinking that is a big maneuver for a little gain. And I hate big expensive things to move the needle a little bit. So I try to butter my patients up. And I usually give some version of explaining the 0 to 10 scale. And of course, I tell this lovely patient that you are literally like a 9.9 on a 10 scale. I'd give you a 10, but you're the one nitpicking yourself. You're 9.9. And it is so difficult for me to move the needle. 0.1, way more difficult to take a 9.9 to a 10 than it is a 2 to a 7. I love the 2 to 7s. Those are home runs every day. You're 9.9. And then so I follow that statement up because really she's wanting a facelift. I'm looking at her like, you don't need one yet. You got some skin texture. I don't have a Morpheus. I got nothing but a scalpel at this point. So I'm looking at her thinking, it's surgery or nothing is our two options. So I'm going to go with nothing. But then I have to get her to accept that. So I explain my little 9.9 on a 10 scale. She's really not believing me. And then I pull out the most powerful tool that you all and I have if you don't have any of these powerful tools. Okay? Get ready to write it down. Take out your pens. It's an H. Write this down. H. Go ahead. U. G.
Hug.
It's a side hug, though. It's important. That's a professional one. It's never a two-arm embrace. 23 years, I know better than that. It's never two arms. It's a side hug. That's a professional hug. So on this wonderful patient here, because I have nothing, and I don't have these devices, I have a scalpel, I don't want to do surgery on her, I give her a side hug after explaining the 10 scale. And I just tell her, through my side hug, you look amazing, you're looking in the mirror way too hard, you're being hypercritical. And what I'm really saying is, I don't have anything to offer you, and I don't want to do surgery. That's what I'm really saying. So tuck that in the back pocket if you don't have these devices. Feel free to use it whenever you want. You can thank me later. Side hug is yours to use. Then I get a FaceTite, or what would now be a quantum and a Morpheus. But back then it was FaceTime. I'm thinking, oh my gosh, okay, now I call her, say, hey, I've got something for you that doesn't require surgery. And then I take her from picture left to picture. Right now we're all really, really happy with the simple in-office procedure. You guys see how that works? So I actually just saw her, was 2016, what are we? Is it 8 years? So I saw her, she's 7 years out. I just saw her this year. And she's still holding up. I should have taken a stinking picture. I saw her, not in the clinic though, so that's why I don't have pictures. It was out in public. And she looked amazing still at 7 years out. More FaceTite plus lipo. This is one of my anesthesia providers. The reason why it's not a standardized photo, the picture on the left is from our training institute, which we have multiple graduates in here from the training institute. It's in Arkansas. Can you all say Arkansas? And it's a hands-on training course. If you desire to do liposuction and FaceTite, BodyTite, we have the ability for you to train hands-on. It has to be in Arkansas. As I travel all over the country on the coast, they're like, why in the world Arkansas? Isn't that where they have kissing cousins and stuff? And it's like, exactly, yes. Because that's also the only other state that would allow you to come and do surgery and procedures on a patient without a state medical license. So I propositioned like 5 states. Kansas, Missouri, Texas, Oklahoma, Arkansas, all the surrounding states. And I'm like, hey, I got a crazy idea. I'm going to set up this institute. You know how our nursing colleagues have packed licenses? They can go across state lines as long as the state is within their structure. We don't have that as physicians. So I'm like, hey, I want to have docs from all over the country come to this institute. I want them to be able to do hands-on. Missouri's like, you're freaking crazy. What are you talking about? They got to get licensed. It's like, I know. Can we do it without? They're like, no. Arkansas is like, we'll do it. So that's why Arkansas. I don't even live down there. So we all go to Arkansas because Arkansas is just like, yeah, that's not like a good idea. So all y'all get to come without a state license, and you're granted reciprocity. You're granted reciprocity on your active state license. You're covered under the Institute's malpractice insurance. So it's legit above board, and it's hands-on. So you all did this case in Arkansas. That's why it's not standardized, because that's the backdrop in Arkansas. This is a 10D case. Henry is also one of the trainers down there. Me and Henry kind of started that thing many years ago. Here's showing you the power of time. This is time 0. This is 6 months. This is 12 months weight stable. You can even see some improved contraction between 6 and 12. Let me show you this view. 0 on the far left, time 6 months in the middle, 12 months weight stable. Out, you can even see some improvement between 6 and 12. Okay, friends, this is another case that I love. She has a very nice result. Remember, excellent care, exceptional results. Excellent care, exceptional results. I would say this patient got amazing care, and I would say she got a really nice result. Not an exceptional one, though. And she thinks it's exceptional, but I'm looking at this. You and I see with my nitpicky eyes, this crap right there just frustrates me. This crap right there just frustrates me. So what do I do? Because I have all these tools in my toolbox. She's super happy. I mean, look where we took her with no surgery. There's some lipo and FaceTite. She's super happy. But I'm like, hey, I can make this better. My team says, why do you always do this? She's so happy. I'm like, if I see it, I know she sees it. She's too nice. She doesn't want to say it. So I'm going to say it because I would want it fixed, or I would want it even more improved. So then I go back and do a couple of Morpheus treatments. Take her there. Now we got exceptional results, right? So this is FaceTite and lipo, 6 months. And then I just see that little residual, just a little Morpheus on the backside to get her the rest of the way. Here's another fun story. This is a mama of 6. Again, just looking by the choice of her underwear bra strap. She's very confident post-procedures, and she subsequently came in for FaceTite. Now she has done FaceTite. She's done core liposuction with a tummy tuck, breast augment lift, thighs, arms. She's done it all, and she came in the door just wanting a little bit of help with her jawline. She was so confident after this that she's like, hey, I'm just going the rest of the way. Let's just do it all. So here's some powerful principles when you're looking at evaluating patients for this type of stuff. When you look at a cervical mental distance, I'm looking at how many fingers can I fit between the end of your chin and where your neck starts. This is like half a finger. So we call that challenging in our world. This is a challenging case. So look at your neighbors with these beautiful necklines. I mean, they got like 4 fingers you could fit in your all's necklines. Like, that's amazing. I got like half a finger. Yeah. So I just an uphill battle. Same with this, uphill battle, right? When you look at, so patients like this represent a huge challenge. So I don't promise the world, but super, super happy she was as well with taking her from picture left to picture right with just a little bit of lipo and skin tightening. Another trick, if you want to improve this, I didn't tell you this. On this patient also received some chin filler, which increases the anterior projection, which increases my distance, my cervical mental distance. The longer that is, the more sexy it looks. So a little bit of anterior chin filler is a nice little trick for those of you trying to increase what these jawlines look like. She did not get any chin filler. Surgeons in the room, if you have this in your toolbox, it's another cool thing, a way you can kind of like see hybrid approaches. I lipoed him, FaceTime. He needed a facelift to get a nice result, and I told him that. But he's a Mason, didn't want downtime, just give me the best you can give me. All right, let's do it. So I told him surgery is my recommendation. This is a really challenging case for me as a surgeon, doing non-surgical things. He's got a thick neck, dehiscent platysma, saggy gland, like all of it. So, just to expect like some lipo and some FaceTite, we gotta make sure we got a good expectation, a reasonable one. And he did. So, but what I did to advance the ball down the field a little bit more, I went in, I lipoed, did FaceTite, and then wide awake, just in my procedure room. He was numb. I made a tiny little incision, so those of you that have this opportunity in your toolbox, and I did just a little anterior corset platysmoplasty. Just put some stitches in that dehiscent platysma muscle to sharpen him up best I could. So I also use this in a hybrid fashion all day long. This gal here, we just saw her not too long ago. So her pictures are only at a week out, but I wanted you to see, again, cervical mental distus, like maybe a finger, maybe. So this is hard to create projection. I did an awake chin implant, and then lipo and FaceTite on her, all awake in a procedure room, and this was her 1 week. You know she's gonna be like crazy awesome, right? So you can see the variability and the breadth that I use these hybrid cases with some other opportunities by itself. So what about someone who should have been surgery? I showed you that male patient should have had surgery, had a pretty good result. This gal, 100% a surgical candidate. So many of you are asking, like, where are the lines? And what I need you to remove from your thinking is those lines, because it's patient-dependent, not provider-dependent. Hear me clearly. The lines in the sand are patient-dependent, not provider-dependent. It's your job to set an expectation, their job to agree with that as reasonable or not. Let me say it a cleaner way. Like, you tell them what you can achieve. If that makes them happy, go for it. So I said surgery, she said no. Like, okay, well, where does that leave us? Either no, or what are the other opportunities? I've got FaceTite, I've got quantum, I've got all these other things. So then I said, this FaceTite can give you a 40% improvement. That's scientifically proven through dermal biopsies, times 0, times 6, and 12 months, where we see retraction of collagen fibrils. And so we got a lot of evidence to stand on a 40% improvement in this much skin laxity. So I show her what 40% is. And she's like, get me whatever you can get me, because I do not want surgery. It's too expensive, don't want the downtime. I'm like, okay, that's a reasonable expectation. She's just like, I will accept whatever result that thing gives me. So again, when you're thinking like who's a candidate, who's not, a candidate is someone who has a reasonable expectation and willing to pay the price that you're asking. That's a good candidate. Is that helpful? So a lot of times we pigeonhole ourselves, and like when we're thinking about candidates, it goes back to like the Instagram picture. You want that Instagram picture. Who's going to be the amazing? That is through your eyes and your perspective. You may have a person like her who doesn't want surgery. She's like, just get me what you can get me. I'll be happy with anything. And then we get her this, and then she's super happy, right? I know. It did a lot better than I thought. So I was like, man, this is going to be a losing battle. But she did amazing, and she got really nice contraction, and everyone's super happy. Now, look at this. I can go back and clean up this little jowl, some more Morpheus, maybe quantum now. We can continue to fine-tune this and get her something that's really fantastic.